Hey everybody, thank you for taking the time to hang out with us today. We're going to be doing our Regence annual Notice of Change webinar. And this is being recorded. So in the event that you have questions about something or you heard me go over it, but you want to listen to it again, that's totally okay. We'll get this recording out to everybody who is on the call. And then also people who registered but couldn't make it to the live will also get the recording. And so before we head into the plan changes for Regence, I just really quickly wanted to cover what's changing in the Medicare prescription drug Part D benefits for 2025. Like, what's all the hubbub about? So this change does affect people who are on Medicare Advantage plans with prescription drug coverage and people who are on standalone Part D drug plans. So it's very important that you understand what the changes are, how they came about. So the Inflation Reduction Act, which was signed into law in 2022, has gradually been changing, some benefits regarding Medicare. For 2025, it's shifting the cost of prescription drugs in several different ways. One of the shifts that you're going to see is that drug manufacturers are going to have to pay more to Medicare beneficiaries' drug costs. And I'll show you what that looks like in a minute. It also has a change of Part D plans having to pay more for the cost of Medicare beneficiaries' drugs. And then the end result is that Medicare beneficiaries will pay less for their prescription drugs. So the goal is to help you guys, knowing that you're on a fixed income, to not have those catastrophic levels of co-pays for your prescriptions. So they are, for 2025, capping your out-of-pocket exposure on Medicare Part D prescription drugs to $2,000. And so it doesn't include Part B drugs if you get infusions or shots administered at the doctor, but if it's a Part D prescription that you get at the pharmacy or through mail order, that is going to be capped at $2,000. They're also eliminating the donut hole for 2025 and beyond. There's no more coverage gap. It's just deductible phase, initial coverage phase. If you get to the $2,000 limit, you are done for the rest of the year. And then they're also adding a Medicare prescription payment plan for people with higher cost drugs. For example, I have a client who's on a standalone Part D drug plan, and she takes a Tier 5 specialty drug that when she goes to the pharmacy in January to get a 1-month supply, it's going to cost her $1,900. Normally, she's got to put that on a credit card. And, it kind of affects her credit because she's putting $1,900 every time she goes. But for next year, if she goes in January, they're going to allow her to spread that $1,900 into payments throughout the entire year. And then when she goes back in February, she only has to pay another $100. And then she's reached that $2,000 threshold. So March, April, May, June, the rest of the year, it's going to be no cost for the rest of her drugs. And let me show you how that gets covered. So in 2024, when the threshold was hit for your financial exposure, which was actually $8,000 in 2024, then after you hit that $8,000 mark, the plan would cover 20% of the rest of the Medicare beneficiaries' drug costs, and Medicare would cover 80% of those costs, and the enrollee had no liability after that $8,000 threshold. But for 2025, it's a $2,000 threshold. So that's a significant difference. And then after you hit that threshold, the plan is now liable for 60% of the cost of your drugs beyond the $2,000. The manufacturer is now going to have some liability in there at 20%. And Medicare's liability is dropping from 80% down to 20%. So as you can see, the plans, which is Part D and Part C plans, are scrambling to figure out how they're going to come up with this and changing plan benefits, removing plans from certain markets, and increasing some premiums or copays or coinsurance or adding deductibles. So we're going to go through what's changing about the Regence plans in this market. We're going to talk about Oregon and Clark County, Washington only on this call. And now you guys have the opportunity from October 15th through December 7th to ask questions. Ask what's changing about your plan. Ask if your doctors are still in network or the hospitals that you want to go to. Review the changes to the plan's drug coverage and make sure that your drugs are still on the formulary. Make sure that your cost sharing is still, in line with what's in the area. You're going to be able to compare this plan to last year's benefits and see if it's still meeting your needs. And we can also compare it to other plans in the market if the plan that you're currently on is either going away or changing and you don't like the changes. And finally, you have the opportunity to choose to stay where you're at, in which case you don't have to do anything. You just roll right into next year on that same plan, or choose another plan in this market that will meet your needs better. And we are here to help facilitate those changes and those questions and those comparisons. So if after this you don't have any questions, that's okay. But if after this you do have questions, please feel free to reach out. We'll get you on our calendar for an individual appointment and review options for you. So the first place I want to start with is the Regence Medicare Advantage coverage map for 2025. This shows that in Lane County, which is in the green, they're going to have the PPO plans and the HMO plan available. But in the blue counties that you see, there are only going to be PPO plans available. So what does that mean for people on the Regence Blue Advantage HMO plan in the Portland metro area? Well, you're probably going to get a letter that looks a little bit like this. It says, important notice, your Medicare plan won't be offered in 2025. So if you're on the Regence HMO plan in the Portland metro area, you need to keep this letter because it's proof that you have special right to buy a Medigap policy or join another Medicare Advantage plan. And you have till December 31st, if you're in this scenario where you got this letter, to make a new plan selection. So that letter, if you didn't receive it, then that means you're probably not on the HMO plan. But if you are on the HMO plan in Portland Metro or Clark County, you need to hold on to this letter. And then the HMO plan is staying active in Lane County only. So I am going to take a minute to go through that plan. And then once we go through your plan, if you're on the call and you get your questions answered, you can drop off the call. You don't have to stay on unless you're curious about the plan details for the other plans that are changing in this area. So this is again for Regence Blue Advantage HMO in Lane County only. The plan is going to remain a zero premium for next year, but they are adding a $200 deductible for medical. And that is going to, I'll explain that in a little bit what that deductible applies to, but it doesn't apply for insulin furnished through an item of durable medical equipment. So max out of pocket is going up on this plan to $6,700. Primary care copays are staying the same. And that's one thing to note. Usually if it's not changing, they don't mention it too much on here. This is specifically for things that are changing. So if you're curious, like if your gym membership is still available, that is not changing. So that's why it's not mentioned on this form. Specialist copays are going up to $45 on this plan for 2025. The hospital copay for inpatient hospitalization is staying the same at $395 copay per day, but it is going to be extended up to days 1 through 6, and then it'll be 0 for days 7 and beyond. They are also not adding a deductible to their Part D prescription drug benefit on this plan. However, Medicare does allow them to charge up to $590 deductible. So if a plan chooses not to add the deductible, they're basically just paying $590 towards your $2,000 threshold. So anybody on this plan in Lane County won't actually end up spending $2,000 towards their drugs because Regence just gave you $590. Now, tier 1 prescription copay is going down to $2 next year at a standard pharmacy or mail order, and $0 copay at a preferred pharmacy. Tier 2 drugs will be $4 at a standard pharmacy or $0 at a preferred pharmacy. And then tier 3 drugs are going down to $25 at a standard pharmacy and only $18 at a retail pharmacy. One other thing to note about this is the plans can charge you up to 25% of the cost of your drugs. So if they're only charging you $18 for a brand name tier 3 drug, that means they're also subsidizing that. So you, again, won't even pay $2,000 for your drugs on this plan because they're paying a bulk of that for you. Now on tier 4 drugs, they are charging 27% at a standard pharmacy, 23% at a retail pharmacy, and then $35 for covered insulin products. So that's not changing. The insulin is staying $35 per month. And then for tier 5, it's going to remain the same as last year at 33% for a standard or preferred pharmacy. And again, once you hit 2,000, you're done. We already talked about the change in the max out of pocket. So this $200 deductible that they're adding for medical for next year, that is going to be applying to all covered services except Medicare covered preventive services, your annual physical exam, emergency care, urgent care, primary care, some telehealth, some labs, some diagnostic services, diabetic supplies or Part B drugs, and non-Medicare covered supplemental services. That means dental, vision, hearing is not going to have this deductible applied. So it's primarily like if you go to the hospital, inpatient, outpatient surgery, inpatient psychiatric, skilled nursing, that's where this deductible is going to apply. So once you meet that, then you'll go into the copays. Ambulance copay is going down next year, which is great. So it's going to go from $290 to $250. Cardiac rehab is going up to $30 per visit. Cardiac rehab virtual was not covered last year, but now it will be at a $30 copay per visit. Dental for Medicare covered services is going up to $45. And then emergency care is going up to $125, so $5 difference from 2024. Hearing services for a Medicare covered hearing exam is going to be $45 copay. And then they're expanding your options for hearing aids by adding a cheaper option, but you'll still have the advanced and premium options available. This benefit is limited to 1 hearing aid per ear per year, and you have to go through True Hearing, which is their in-network provider. Last year, they did not cover home and bathroom safety devices, but this year they're going to give you a $15 allowance every calendar quarter to use to buy over-the-counter items. We talked about the hospital stay extending to 6 days of copays. Inpatient mental health copay is going down to $380, but it is going to be for days 1 through 6, and then no charge for days 7 through 190, which is really good because some plans only cover to day 90. So that's a little extra. They're not going to be offering the meal delivery for chronic health conditions, but they will continue to offer meal delivery after a hospital stay or a skilled nursing discharge. But they are decreasing it to 28 meals instead of 56. And it has to be requested within 30 days of discharge. Opioid treatment is going from $0 to a $45 copay per day. Outpatient diagnostic tests and procedures is going from $0 to $20. And then x-rays are going to be $10 copay per day. And then you're going to pay $400 for an outpatient surgery for next year instead of $350, which not terrible. Outpatient mental health care will be $35 per visit unless you get it through a primary care nurse practitioner or a social worker. Outpatient rehab in office, including physical, occupational, and speech therapy, was $25 this year. It's going up to $35 for next year. And then virtual visits were not covered last year, but this year they will be covered at the same copay as an in-person visit. Outpatient substance abuse counseling, whether individual or group, is going up to $35. Outpatient surgery at an ambulatory surgery center will be $45 copay for wound care, or 20% of the cost for all other ambulatory surgery center services. So instead of a flat copay, it's saying potentially 20% coinsurance. If you go to a hospital for outpatient surgery, it's $45 for wound care and 20% for the other outpatient surgical services. Over the counter, you get that $15 credit we talked about per quarter. Partial hospitalization or intensive outpatient services is $105 copay per day. They're no longer going to be covering the personal emergency response devices for 2025 or the monthly service. Then you can have a copay of $45 for specialist visits, and then $40 for virtual specialist visits. Podiatry is going to be $45 instead of $35, and pulmonary rehab will be $30 instead of $15. Inpatient dialysis is going to be a copay of $395, but they extended it days 1 through 6. Skilled nursing, $0 copay for days 1 through 20 last year, but this year it's going to be a $10 copay per day for days 1 through 20. Then it's going to the Medicare allowable charge of $214 for days 21 through 37, and then back to $0 for days 38 through 100. And the virtual diabetic prevention program is not covered for 2025. We talked about the changes to the drug coverage, so that we already went over. And then they did want to let you know that Essentia Breeze is not going to be a covered model of glucose monitors for next year. And also that this plan will offer the Medicare prescription payment plan for 2025 that I talked about, that said if your copay at the pharmacy is going to be really expensive, like over $600 for one drug, they'll allow you to make that a payment plan throughout the year. It just has to be paid off by the end of the year. You're going to get a new blue Flex Dollar card for 2025, and you can start using that new card January 1st. And again, this HMO plan is only going to be available in Lane County, Oregon. So if you were on the HMO plan with with Regence, that you live in Clackamas, Multnomah, or Washington County, that plan is no longer available, and you have a special enrollment period to change to a Medicare supplement with no underwriting, or pick another Medicare Advantage plan by December 31st. So any questions on the HMO plan in Lane County, or questions on HMO people who are losing coverage for 2020, like at the end of this year? No questions? Okay. You could also put them in the chat. I got Christina on here moderating. She can help answer questions too. So now we're going to go to our next plan, which is the Regence Medicare Advantage Plus RX primary PPO in Oregon. This is for Metro and non-Metro, but it does not include Clark County. That's a different plan that we'll have to go over in a minute. Pull this over here. And okay, so this plan was $0 premium in 2024, and it is going up to $29 a month for 2025. This is the PPO plan, so it still has Legacy and OHSU in the network, but it does not have Providence doctors in the network. It has the same max out of pocket next year for in and out of network coverage, and primary care visits will remain $0. And specialists will be $40. So that's not changing. Now, what is changing significantly on this plan is the out-of-network cost sharing. It's pretty much going to 50% across the board for out-of-network services. Apparently, they're having a hard time controlling costs, and this is just a way to make up for it. So 50% for out-of-network primary care visits, 50% for out-of-network specialist visits. But of course, you do have this in and out of network max out of pocket of $95.50. If you end up in the hospital, the in-network cost sharing is not changing. It's going to be the same as 2024, but out of network is going up to 50% of the allowed amount. The Part D plan is going to have a $100 deductible, but keep in mind they could charge up to $590. So if they're only charging $100, that means they're paying $490 towards your $2,000 prescription drug max. They are lowering the copay for tier 1 drugs at a standard pharmacy, and then there'll be $0 at a preferred pharmacy. Tier 2 drugs are going down to $6 at a standard pharmacy, $2 at a preferred pharmacy. Tier 3 drugs are going to be 23% of the cost at a standard pharmacy or 19% at a retail. So that is also being subsidized because they can charge 25%. So if they're charging less, that means they're paying the difference for you. Tier 4 drugs will be 43% at a standard pharmacy and 40% at a preferred retail pharmacy. But keep in mind those insulins will still only be $35 per month. And then your tier 5 drugs are 31% for a 30-day supply. So we talked about the premium changing. Now we're just going to kind of go through some of the benefits. So out-of-network coverage. This is for all facility services, acute psychiatric inpatient hospital, ambulatory surgery center, outpatient hospital, observation, partial hospitalization, and skilled nursing. Office visits, including Medicare covered chiropractic and acupuncture, dental, hearing, mental health, podiatry, all preventive care, primary care, psychiatric, specialist, substance abuse, telehealth, and everything else you see on here is going to be 50% out of the network. So that is definitely something to think about. Ground ambulance for in or out of network is going down to $300 per one-way transport. If you get cardiac rehab in an office, that's going to be $25 in network, 50% out of the network, and virtual is the same cost, $25 in network, 50% out of network. Medicare covered chiropractic is going to be $20 copay in the network, 50% out of the network. Emergency is the same cost, whether you're in or out of the network. So if you're traveling and you have a medical emergency, you can go to the nearest ER and it's just going to be $125 copay. It doesn't matter if it's in network or not. Like we talked about, they're adding additional hearing aid options with a lower copay if you're okay with standard instead of advanced or premium. But you do have to use True Hearing to get your hearing aids in order to get it at those copays. This plan will have a $15 allowance every quarter for over the counter. That wasn't offered last year on this plan, but it will be offered for 2025. And then nothing is changing about the hospice. It looks like that's staying the same. So we'll go to inpatient mental health. That copay is going up. So if you end up in an inpatient mental health facility, you're going to pay $410 per day for days 1 through 5, and then no charge for days 6 through 190 if you go to an in-network facility. But if you go out of the network, it's 50% of the cost for days 1 through 190, which means you'll definitely hit your max out of pocket on there. Meal delivery for chronic health conditions on this plan are also not going to be covered for 2025. But they are still going to cover it for a post-hospital discharge up to 28 meals. Opioid treatment is going up to a $40 copay on this plan or 50% out of the network. Outpatient labs are no charge if you get your A1Cs tested, but $30 copay for all other lab services and 50% out of the network. Other outpatient diagnostic tests and procedures are $35 on this plan per day or 50% out of the network. X-rays will be $20 or 50% out of the network. Outpatient observation services, a flat copay of $400 per stay. That's like if they have you at the hospital, but they don't admit you, that's observation. or 50% out of the network. Physical therapy, occupational therapy, and speech therapy are going to be $40 per visit on this plan, or 50% out of the network. Virtual health will be the same cost for PT, OT, and speech therapy, or 50% out of the network. Ambulatory surgery centers, $40 copay for wound care, 20% of the cost for all other care. So if you go in for a cataract surgery or something to that effect, you're going to spend 20%. And then let's see, I don't think they mentioned that one yet. Let's see if we get to that. If you get that outpatient surgery at a hospital, it's also 20% unless you go out of the network, and then it's 50%. Over the counter is 15, partial hospitalization, 105 per day, or 50% out of the network. Virtual telehealth for specialist services is 35 copay per day, or 50% out of the network. And then for skilled nursing, you're going to pay $10 copay for days 1 through 20, $214 for days 21 through 49. So that's per day. And then it goes to $0 for days 50 through 100. Out of the network, 50% of the cost. Urgent care is the same copay in or out of the network at $45. So if you're having an urgent need, don't go to the emergency room if it's not life-threatening, because it'll be a lot cheaper at the urgent care. And then virtual diabetic prevention program is not covered. If you didn't see anything on here for mental health, that means it's staying the same. So I don't think they mentioned that on here, but let's see. Take us there. Mental health, 50% out of the network, but they don't mention it in the network for just outpatient services. So it's going to be the same copay as this year. And we went over drug plans changes. So the only thing we haven't covered is, again, on this plan, they're no longer going to have Essentia Breeze as a covered glucose monitor. And you're going to get a new flex card to spend that $15 a quarter. This plan does include Portland Metro, Marion County, Yamhill County, and Lane County, and Columbia County. Any questions on the Portland Metro and non-metro in Oregon? So county is non-metro, primary PPO plan. No questions on there. Maybe Christina can pull up the summary of benefits for that PPO plan and look up the mental health copay. I'm going to move to the primary PPO in Clark County. So this is a slightly different plan because it's a different county. So the premium was $22 this year. It's going to be $53 a month for 2025. Same max out of pocket in network, same combined max out of pocket for in and out of network services. Primary care is staying the same, specialist is staying the same, but copays are going up for out of network services, as we've seen on the other plan, 50% coinsurance out of the network. Hospitalization in network copays are staying the same, out of network, 50% coinsurance. This plan is also adding a $100 drug deductible, so that will apply to tiers 3, 4, and 5 prescriptions, but tier 1 and 2 generally are not subject to the deductible. And there are some cost sharing changes. Tier 1 is going down to $3 at a standard pharmacy. Tier 2 is going to $6 at a standard pharmacy. And then tier 1 will be no charge at preferred retail, and only $2 at preferred retail for tier 2. So you can see that is much lower than last year. Tier 3 drugs will be 23% at a standard pharmacy and 19% at a preferred retail pharmacy, but insulin is remaining $35 copay per month. Tier 4 is 43% at a standard pharmacy and 40% at a preferred retail pharmacy. And you pay $35 for a month's supply of covered insulin. And then tier 5 drugs, 31% at a standard or preferred retail pharmacy. And let's see. basically the same thing on this plan. Everything is pretty much going to 50% out of the network for all of these services. Then cardiac rehab is going up to $25 in the network, 50% out of the network. Cardiac rehab virtual was not covered last year, but now it will be covered with a $25 copay in the network, 50% out of the network. ER is going to go up to $125, but that is in and out of network. They are adding the extra hearing aid of $499 to this policy for next year. So you have 3 levels of options with True Hearing. This plan is also going to get that $15 over the counter credit. And let's see, meals after a hospital stay or hospice care is not covered. Chronic health conditions will not be receiving the meals for next year, but they will continue to do postage charge meals on this plan with a maximum of 28 meals for no copay. Opioid treatments going up to $40 copay per visit on this plan and 50% out of the network. Then you have A1C testing at no charge, but other lab tests is going up to $20 per visit or 50% out of the network. Outpatient diagnostic tests and procedures are going up to $20 in the network, 50% out of the network. Other X-ray services will be $20 copay in the network, 50% out of the network. And then outpatient hospital observation is going up to $400 in the network, 50% out of the network. So don't get observed anywhere but an in-network facility if you can help it. Outpatient rehab in-office visits for physical therapy, occupational therapy, and speech therapy are going up to $40 per visit or 50% out of the network. So those are changing a little bit. They are offering virtual OT, PT, and speech therapy for the same copay as if you were in person. Outpatient ambulatory surgery center is going up to 20% instead of a copay of $300. But if you go out of the network, it's going to be 50% for that same surgery. And then if you do it at a hospital, it's still going to be 20% in the network, 50% out of the network, but hospitals usually charge more than surgery centers. You will get the $15 over-the-counter credit, but you can also use that for bathroom safety devices, which are very handy. Partial hospitalization is going to be a flat copay of $105 per day or 50% out of the network. And then virtual telehealth for specialists, it wasn't covered last year, but now it's going to be $35 for 2025 or 50% out of the network. And then with skilled nursing, they are adding a copay for the first 20 days of $10. Then days 21 through 49 will be $214, and then it goes down to $100 for days 50 through 100. Unless you go out of network, then it's 50%. And the virtual diabetes program is not going to be covered next year. We talked about drugs, but I just want to reiterate, Tier 1 and Tier 2 drugs shouldn't be affected by the deductible, but Tier 3, 4, and 5, you'll pay the full cost of the drugs until you hit the $100 deductible, and then you go into the cost sharing listed on your annual notice of change. Ascensia Breeze is not going to be a covered glucose model, and you're going to get a flex card next year to spend those over-the-counter credits. Any questions on the Regence Clark County Classic PPO, primary PPO? No questions on that one. All right, we're moving on to the Classic PPO in Washington. So if you are on the Classic PPO, that is coming up. Actually, we're going to do Oregon first. I misspoke. Okay, so this is the Classic PPO. This one was $44 a month for 2024, and it's going to $73 a month for 2025. but the max out of pocket is staying the same, which is good because other plans are definitely bumping those up. And the in and out of network is going to be $9,550. Copay for in-network primary care is not changing. That will still be $0 copay, and a specialist will be $40 just like this year. But if you go out of the network, it is going up to 50% on this plan as well. The hospital copay is staying the same for in-network services, but out-of-network is going up to 50%. Sorry if I sound like a broken record. Hey, the good news on this plan is it's only going to have a $50 deductible, so that is definitely good. That means they're subsidizing $540 of that deductible for you. Tier 1 drug costs are going down at a standard pharmacy and will remain $0 at a preferred pharmacy. Tier 2 is $13, so that's also going down at a standard pharmacy, and then $10 at a preferred pharmacy. Tier 3 drugs are 25% next year at a standard pharmacy and 22% at a preferred pharmacy, but your prescription insulin that's on their formulary will be $35. Tier 4 drugs will be 43% instead of a flat copay for 2025, and 40% at a preferred retail pharmacy. Tier 5 prescriptions will be 32% at a standard pharmacy and a preferred pharmacy. So that's going down from this year. And you'll cap out at $2,000 on this plan as well. So just like the other plans, they have decided to move all out-of-network benefits to pretty much 50% coinsurance. So this whole list of everything that they offer is 50% out of the network. Acupuncture is not going to be covered next year, only Medicare covered services. So if you had this plan because you like routine acupuncture, that will not be covered next year. Cardiac rehab for virtual visits will be covered, though, with a copay of $20 or 50% out of the network. Chiropractic services for routine chiropractic will also not be covered. So none of the Regence plans for 2025 are going to have alternative care in them, but they will have Medicare covered chiropractic. Emergency care is going to be $125 copay on this plan. They are offering the extra hearing aid benefit. So if you need a cheaper hearing aid model, you can get that on this plan, but you do have to go through True Hearing to get it. This plan is going to have a $20 over-the-counter benefit that you can use for over-the-counter items or home or bathroom safety devices. It looks like meal delivery for chronic health conditions will not be covered on this plan, but they will still cover post-discharge meal delivery with a max of 28 meals. Naturopathy is not going to be covered next year on the Regence plans, none of them. Opioid treatments going up to $40 copay in the network or 50% out of the network. Outpatient observation is going to be $400 like we've seen on the other plans, or 50% out of the network. Outpatient virtual visits for physical therapy, speech therapy, and occupational therapy will just be a $30 copay. So sort of like if you're going in person, and then 50% out of the network. If you get a surgery at an ambulatory surgery center, you're going to pay 20% instead of the $300 flat copay they had this year. And then 50% if you go out of the network. Same thing for outpatient hospital services. You're going to pay 20% coinsurance for a surgery, outpatient surgery at the hospital. If you go out of the network, it's 50%. And then partial hospitalization is the same copay as the other plans, $105 per day or 50% out of the network. And the personal emergency response system that was available on this plan for 2024 is not going to be covered for 2025. Virtual telehealth with a specialist will be covered for a $35 copay in the network, 50% out of the network. And then skilled nursing is going up to a $10 copay for days 1 through 20 Then 214 for days 21 through 47, and then back down to 0 for days 48 through 100 at an in-network skilled nursing facility, but 50% if you go out of the network. And they will no longer be offering their virtual diabetes prevention program in 2025. We talked about the drug coverage already. So again, Ascensia Breeze is not a covered model for their glucose monitor. And you're going to get a flex card for 2025 to spend that $20 over-the-counter credit. So that's pretty exciting. Ooh, it's trying to make me get on there. Let's see. This does include Clackamas, Columbia, Lane, Marion, Multnomah, Washington, and Yamhill counties. So if you want to stay on this plan, you don't have to do anything. It just rolls right into next year. But if you want to schedule a visit with us to talk about other options, you can get on our calendar, just send us an email and we'll get that process started. Any questions on the classic PPO? I see Christina is helping in the chat. All right, so now we'll cover the classic PPO in Washington. Probably gonna look pretty similar, but I'm guessing they'll probably still have 50% out of the network. But the premium is going up, and you're welcome to leave if this plan doesn't apply to you and you already got your questions answered. So this plan is going up to $99 for 2025. That's a per month copay or per month premium, but no change to the max out of pocket. Primary care will still be 0 and specialist will be 30, but out of the network, it's going up to 50% for primary care or specialist visits. The hospital copay is changing on this plan to $425 copay per day for days 1 through 4, and then 0 for days 5 and beyond in network. But if you go out of network, 50% coinsurance. The deductible for prescriptions is going to be $50 on this plan, and that does not account towards tier 1 or tier 2 drugs or covered insulin products and most adult vaccines. The copays for tier 1 are going down at a standard pharmacy. Copays for tier 2 are also going down for standard and retail pharmacy. The drug tier 3 cost is changing from a flat copay to percentage of the cost. So 25 at a standard retail or 22% at a preferred. Tier 4 drugs are also switching from a flat dollar copay to a percent of the cost. But keep in mind, you are capped at that $2,000 for 2025. And then tier 5 drug cost is going down to 32% from 33%. So we did talk about those changes. Out of network is going to 50% for all these covered services. They're eliminating routine acupuncture. That will no longer be covered. They're also taking routine chiropractic out, but will remain Medicare covered chiropractic services. And then cardiac rehab virtual telehealth visits will be covered with a $20 copay in the network or 50% out of the network. Emergency care is going to be the same $125 copay in or out of the network that we've seen on the other plans. And it looks like on this classic plan, they're also adding the extra hearing aid options. You're also going to get an over-the-counter allowance on this plan of $20 per quarter, where you didn't have it before. So that's a nice benefit. We did talk about inpatient hospitalization going up to $425 per day for days 1 through 4, and then 50% out of the network. Inpatient mental health is also changing to $425 copay per day for days 1 through 4, and then 0 for days 5 through 190, but 50% out of the network for the full stay of up to 190 days if you go out of the network. They're not going to be continuing the meal delivery for chronic health conditions, but they will keep it going for a post-hospital discharge for a maximum of 28 meals. Naturopathy is also being eliminated. Opioid treatment costs is going to $30 in the network per visit or 50% out of the network. X-rays will just be $5, so that's not bad. Out of the network is 50%. Outpatient hospital observation is going to be $400 flat copay per stay, and then out of the network is 50%. Outpatient rehab virtual visits, $30 copay in the network, 50% out of the network. And then if you go to an ambulatory surgery center for an outpatient surgery where they send you home the same day, you're going to pay 20% instead of a flat $300 copay. Unless you go out of the network, then you're going to pay 50%. For outpatient surgery at a hospital, you're still going to pay 20%, but I'm sure that bill will be higher than a surgery center. Out of network is 50%. They are going to give you $20 over the counter credit for OTC and bathroom safety device. Partial hospitalization is going to be a flat copay of $105 per day in the network, but 50% if you go out of the network. They're no longer covering the personal emergency response system for 2025, so that is going away. And specialist visits virtually will be offered for 2025 with a $25 copay or 50% out of the network. And let's see, services to treat kidney disease like inpatient dialysis, that is the same copay as inpatient hospitalization, $425 per day for days 1 through 4, and then $0 for days 5 and beyond in the network, but 50% out of the network. And then you'll see that $10 copay for skilled nursing on this plan as well. It looks like their plans all look really similar. $10 copay for days 1 through 20, $214 for days 21 through 47, and then no charge for days 48 through 100. If you go out of the network, it's 50%. And this plan will also not be covering the virtual diabetes prevention program. We talked about the prescription costs. So finally, Ascension and Breeze is not covered for next year. And you're going to get a new Flex card to start using January 1st. Any questions on the classic plan in Washington? Okay, so we just have one more plan to go through. This is the Valiance plan. So this plan is a Medicare Advantage plan with no prescription drug coverage. This is typically designed for people who have VA drug coverage and don't need a plan with Medicare drug coverage because they just get all of their drugs at the VA. And you can stay for this plan if you want to hear about it, or you're welcome to drop off if it doesn't apply to you. And we'll go through this one. So no change to the premium for next year, no change to the in-network max out of pocket, and no change to the out-of-network max out of pocket. Primary care visits will be no charge, and specialists will be $35 in the network. Out-of-network is going to 50% on this plan. And in-network hospitalization copay is staying the same as this year, but out-of-network cost is going to 50%. There's no, this plan in 2024 had a $60 per month Part B premium reduction. That is changing to a $30 Part B premium reduction. So that means they're going to help pay $30 towards your Part B premiums every month. We talked about the max out of pocket staying the same, but out of network benefits are going to 50% on this plan. Acupuncture will no longer be covered on this plan for routine acupuncture, but Medicare covered services are still available. Virtual cardiac rehab visits will be available at a $20 copay per visit or 50% out of the network. Routine chiropractic is not going to be covered next year, but Medicare covered chiropractic will still be available. The emergency copay for in or out of network ER visits is going to be $125 per visit. They are adding the additional hearing aid options on this plan as well, so you can buy a cheaper model if you don't need the, super fancy ones. Home and bathroom safety devices being combined with the over-the-counter credit. So you're going to have $40 a quarter to spend on over-the-counter items or home and bath safety devices. They're discontinuing the chronic meal benefit, but they will let you keep the post-hospital discharge maximum of 28 meals instead of 56 for this coming year. Naturopathy is not covered next year on the Regence plans. Opioid treatment is going up to $35 per visit on the in-network providers, or 50% out of network. Outpatient hospital observation is going from $275 up to $400 copay in network, or 50% out of the network. Virtual physical therapy, occupational therapy, and speech therapy will be $35 per visit, or 50% out of the network. Outpatient surgery at an ambulatory surgery center will be 20% on this plan, or 50% out of the network. If you get that same surgery at a hospital, it's still going to be 20% or 50% out of the network. Again, we talked about this plan having that $40 over-the-counter credit, which is the same as last year for the over-the-counter credit, but I think the bathroom safety thing was a little bit more, so that part is changing a little bit. Yeah, you had a $100 allowance every year for bathroom safety, and now it's just moving to that $40 credit per quarter. If you have partial hospitalization, it's $105 copay per day, unless you go out of the network, and then it's 50%. The personal emergency response device will not be covered for 2025. Virtual telehealth visits with a specialist will be covered for 2025 with a $30 copay in the network, or 50% out of the network. Skilled nursing, in network, you're going to pay $10 copay for days 1 through 20. You'll pay $214 for days 21 through 44, and then it goes to $0 for days 45 through 100. Out of network, you're going to pay 50% of the cost. Therapeutic massage is not covered next year. Virtual diabetes prevention program, not covered. And the Ascension Breeze is not a covered model of glucose monitors. You can use your OTC benefits to buy bathroom safety devices, and you will get a new Flex card in 2025. This plan does include Benton, Clackamas, Columbia, Douglas, Jackson, Josephine, Lane, Lynn, Marion, Multnomah, Polk, Washington, and Yamhill counties in Oregon, and Clark County in Washington. Any questions on the Valiance plan? Nope. Okay. Well, our commitment to you is to be here if you have questions. We'll be here to help you navigate other options. So just reach out to us if something comes up and you want us to look into new options for you for 2025. Thank you for listening.